Army Medicine uses virtual health to deliver safe care while maximizing technology and enhancing the patient experience. This remarkable platform improves readiness by being available in deployed and garrison environments. It offers cost-effective but comprehensive care, regardless of the patient location. Virtual health extends Army medicine to the point of need.
Most people don't understand what virtual health is. They may be confused about what exactly I'm going to be doing. You tell them, well, you're going to sit in front of a camera and there's going to be a tech on this side. They're going to use some instruments, guided by the physician on the far side. They may be a bit put off by that because they're used to having a provider in the room with them.
I had a very bad cold, just feeling terrible body aches. And then they just came and asked me, do I mind being seen through the telehealth? And I was like, okay, anything to get me out because I was feeling bad. So I said yes.
My thought process is see the patient safely and reliably. Make sure that they are treated well and make sure that they're comfortable. Because it is a new concept, so it can be a little unnerving to have a doctor far away and to rely on somebody that isn't quite always there. But with this program, with all our technology and our equipment, it almost feels like the doctor's there. The only difference is he's not physically touching you.
The first thing he did was look down my throat and he explained to me what he was getting ready to do. He did it very professionally. I mean, I could see on the camera my throat and everything, and he showed me the instrument that he was going to look in my ears with and everything. And if they say, oh, you clear, but you can actually see that your throat is clear, or you can actually see your eardrum is clear. It kind of gives you a sense of, I got some good care.
My goal as a medic is to follow the doctor's directions to the best of my ability and to treat the patient to the best of my ability and to make sure that they have a good visit and that they can go home feeling better and that down the road the issue doesn't come back and that we can overall treat them just as any other visit.
I was just amazed. It was just really good because once he hooked me up to all these little gadgets and everything, and the colonel came on the screen, and it was really great. The tech was very great.
Most of our patients really enjoy it, especially some of the elderly patients where we were worried they wouldn't, but a lot of them opened up to it and thought it was the greatest idea ever. Younger patients like seeing the new technology. And every once in a while we do have those few patients that they have worries because the doctor isn't there. And we understand that, but the personal touch is with the medic there. And then we try and do the best that we can to be that doctor's hands and to make sure that the doctor is talking to them and really interacting with them. They really enjoy, especially the cameras, being able to see just everything that we see so that it's not just you're going off what the doctor says, you actually can see it yourself and it can be explained a little bit better.
This may open up the opportunity to see that provider now. Now granted, they're not in the room with you, but based on the footage I saw from the cameras that were used, they don't need to be right there. It seemed like the two-way communication was phenomenal.
With all the low-density specialties that we have in the medical community, it enables those specialties to be brought to bear where they're needed. And I think it can be hugely important, not only for the medical professionals and what they do, but for the faith and trust that our soldiers and families depend upon.